Dental health is often an afterthought, and most people really don't consider the health of their mouth until it becomes a problem. Well, today's guest and I are going to dive into how your health in your mouth is really foundational for your overall health, and I'm so excited for you to listen. Welcome back to the Evolving Wellness Podcast. My name is Sarah. Today I have on Dr. Stephen Lin, who I'm a huge fan of. I've actually been following him since 2019. I think he disappeared for a few years and has resurfaced. I originally invited him onto the podcast about 4 years ago, and he just resurfaced about a month ago asking if I would still like to have him on the show. Of course, I jumped at the opportunity because Dr. Lin really looks at overall health and how things that are going on in your mouth, especially for children, are indicative of your health in your entire body. So I'm really excited for you to listen to today's episode. Make sure you head down to the show notes to get all of Dr. Lin's information. Follow him on Instagram. He has a fantastic book, and there's a lot here that I think you're going to enjoy. So thank you so much for watching the show or listening. If you've been listening to the show for the last few years, you know I'm a huge fan of red light therapy. There are over 10,000 studies now in publication showing the health benefits of red light therapy. And there is a lot of research showing how red light therapy can help to improve skin health. I have been on the fence about trying one of the red light therapy face masks, and I've definitely been waiting to find one that uses the specific frequencies that actually show improvement with skin health. 630 nanometers for red and 850 nanometers for near infrared. And Bond Charge checks off all of those boxes. So I've been trying this mask out for the last month and I absolutely love it. It's super lightweight. It does not make your face sweat and it's very simple to use. All you need is 10 minutes. You can actually use my code Sarah Kleiner, all one word, to save 15% off at Bond Charge. You can use it on any of their products, but I really, really like their red light therapy face mask. And I think it's something that's worth a try if you're looking to naturally improve your skin health. So check it out. Again, use code Sarah Kleiner, all one word, to save 15% over at Bond Charge. A lot of people are becoming aware of the impact of minerals on our cellular hydration and energy processes of the body. They are literally indicated everywhere, and having a mineral imbalance can contribute to poor sleep, low energy, muscle cramps, and so many other problems. But what a lot of people don't understand is that taking exogenous minerals can actually cause issues. For example, adding a lot more sodium into your diet can push down your potassium levels, and adding zinc exogenously to your body can push down your copper levels, and vice versa. So, how do you know what minerals you actually need? I'm a huge fan of the upgraded formulas hair tissue mineral analysis. You can use code YOGI to save 10% on the test or anything on their site. And I highly recommend getting a consultation so someone can walk you through that test. Oftentimes, what comes back is not something that is easy to interpret on your own. But a mineral test using your hair is going to show what's been going on in your body over the last 60 to 90 days, whereas a blood test is only going to show a snapshot of time. I'm a really big fan of this hair tissue mineral analysis from Upgraded Formulas, along with a consultation. You can get yours by following the link in the show notes and using the code YOGI for 10% off the test and consultation or anything on the Upgraded Formulas website. Hello, everyone. Welcome back to the podcast. I'm very excited to have Dr. Stephen Lin with us today. I've been following him, I think, since 2019. He's just got a really wealth of information on health in general. You are in dental health in particular, but you really do a great job of covering all the foundations. So thanks for being here.
Thanks, Sarah. Thanks so much for having me. And yeah, it's been interesting moving into the kind of the areas as well that you've really helped educate people on as well, which I think is so important. It's such a big piece.
Yeah, I found you back in 2019 and you were when I was doing like pure carnivore and I was just very much into the carnivore community. And you were like the first dentist that I found that was talking about the importance of nutrition. That was kind of like no dentist had ever really said, hey, you need to eat enough meat, you need to eat enough nutrient dense food, And so that's why I started following you in your work, because you really did a good job of explaining that.
Yeah, thank you. That was kind of my way, and probably about, I mean, if you kind of look in how when I first started thinking and talking about all that stuff, was, probably nearly 10 years before that, I started to kind of, as I was early in my clinical career, I wasn't just very happy with just straight clinical dentistry. It just wasn't something that really stimulated me in that sense. So I began to kind of think about what I was going to do, and I went traveling for 6 months to try and think, can I really do this? Because it's not really satisfying me at a deeper level. And then I stumbled across a book written by Weston A. Price, who was a dentist that went around the world, and he wrote a book called Nutrition and Physical Degeneration. And
Mhm.
that book showed me that his thesis, where he said, well, modern food's actually destroying the human, both tooth structure in terms of tooth decay, but also crooked teeth. And he showed this with ancestral cultures all around the world. So 12 cultures. He went to them in the 30s and actually looked at them at the intersection of the modern diet and where the traditional diets have been eaten for generations. And he showed that the tooth organ, the jaw, deteriorates in one generation in pictures. And I kind of looked at this thing with my modern kind of dental training. I thought, this is I don't even know what this is, but it looked interesting and it looked like something, maybe that I would come back to. Threw it in my bag, and I kind of went back to work. And then eventually it started to pop up again with these ideas of, hey, something's going on.
Mm.
And I began to look again. Like, he was actually showing that crooked teeth or malocclusion was directed by diet. And that was a
Mm.
really interesting concept for me, because in dental school, they don't teach you about the underlying pathology and the underlying process of why crooked teeth occur. We just classify it. So you say class one occlusion, class two occlusion, class three occlusion, and then you look at how the grade of space that's needed. And then there's not really much else said about why it's happening. And then so that kind of led me down a track to understanding, well, hey, nutrition is a big part of this. And he talked about how a meat-based diet, and how, in particular, what he said was organs and nutrient-dense foods. So these precious set of foods that have a lot of nutrients in them, that cultures all around the world really veneered, and they really kind of looked at focusing on eating, because if they didn't, they knew that their kids wouldn't grow up healthy and that they would get sick. So eating these foods made people healthy, and this is what gave them this amazing dental arch. And so that was kind of like a concept. I was like, wow, this is a big thing. It's like, it's telling us stuff about eating, one that is different to what we really think, which is kind of like, hey, animal foods are bad for you, should avoid. And I'd always been kind of like an active, sporty person, but the idea that saturated fat was bad was still, in my life. It was still, I would look at a steak and go, well, I shouldn't eat that kind of thing. And I didn't eat
Mhm.
butter on purpose. But then I began to kind of change myself, and then, and you feel better. Like, I wasn't sick or anything, but I was, feeling that like my body was working better. I was like, oh, there's something to this. Began
Mhm.
to read books, began to look at research, and you begin to see that, hey, actually, modern research shows that Price's work is all verified, and we can look at that through the mechanism of vitamin D, which we'll talk about after, which is, it goes into a whole journey of how light travels into the body. But the big one about that is that vitamin D is a director of calcium, and that's the main constituency, well, one of the constituencies of bones and teeth. And then,
Mhm.
so when you look at the metabolism of calcium, all of a sudden you see, well, vitamin D deficiency is critical with that. Why don't we look at vitamin D deficiency in terms of its effect on dental health? And that's what he was basically saying, without having the blood tests and having the kind of, the actual studies to show that vitamin D does affect the dental organ. And it does. And we've got, a small amount, but we do have research showing that tooth decay is linked to vitamin D deficiency. There's a Canadian study from 2015, I think, that showed that blood levels below 75 nanomoles per liter, which is roughly 40, I think, or 30 or 40
US
in milligrams per
milligrams.
yeah, per
Mhm.
milliliter. And then so what they showed is that below this titer, so 75 to 50, the risk of decay goes up. So you have a relative risk depending on your levels of vitamin D, and like that's then showing that hey, there's a measurable risk when we have lower vitamin D in the body, which is again sunlight. So
Mhm.
all of these things start to kind of to pan out. And one of the big mysteries, actually, that Price kind of left in his book is that there were three nutrients playing with vitamin D. One is vitamin D, which is one that the research has shown that we, obviously has effects on the bone system, but the applications has been a bit controversial. And it's for instance, vitamin D supplementation has been a little bit probably you would say not utilized maybe as much as it should have been because of research on the concerns of its efficacy and safety. And that was
Mhm.
based around the risk of heart disease. When, for instance, women with osteoporosis took vitamin D and calcium, they had a small increase in heart attacks and no increase in bone density. But Price's work actually explains that. And the reason being is that vitamin D has partners. One is vitamin D and vitamin A. Vitamin A is a very misunderstood nutrient as well.
Yes.
That's the one that our eyes use to
Yes.
transmit light to the brain. So vitamin A
Yes.
is like this. It's like a female partner to vitamin D, really, that we really just don't kind of acknowledge. But
And blue
it's
light
very
destroys the
important.
vitamin A in the eye. It creates that harmful form of retinol that actually destroys vitamin A in your body. Most people don't know that because they're blasting themselves with blue light constantly, and it's like you're literally destroying the vitamin A that's supposed to be signaling your brain. And I think a lot of it's stemming from blue light toxicity and not consuming any organ meats, any vitamin A rich animal foods. Um,
Absolutely, yeah. So
yeah.
then if you look at, and you're just looking at a very simple pathway of Leaky, one through vitamin D through the skin or food, there's a few ways to consume it. And the body kind of collates this in the liver and then we'll put it into the blood. But then the vitamin A helps the light also travel into the brain, and this is signaling hormones. And this was,
Mhm.
we are talking, quickly before we jumped on, is that light is so fundamental in balancing hormones and how the brain and body recalibrates itself in order to get everything back in order, and then this cascade of hormones leave. Vitamin A is really important for that. So then obviously the light environment, as you say, is going to harm that. It's like an instrument there that we have that's kind of very finely tuned to the sun and the environment. But then the vitamin D is the partner and the drive and the how the body forms a lot of the constituencies, and they work together. But also vitamin A is critical in bone turnover as well.
Mm.
It's critical in immunity. So one big thing I think that we in dental health that we don't acknowledge is the role of vitamin A in on our gums and teeth, because it's a barrier
Mm.
organ. It's literally how our lungs, for instance, form the barrier between the mucosa where the air and the sacs of the lung transmit air and oxygen. So when you're deficient in vitamin A, you have a lung and respiratory system that is not working very well, and
Mm.
that's for the skin. But the big one is gums, and I stumbled across some work on topical vitamin A for the dental organ that was actually done in the 80s, and that basically when you apply concentrated vitamin A, you see a very marked improvement in gingival inflammation, pocket inflammation, which is periodontal disease. And then so you're starting to talk about, hey, this defense system, and instead of just feeling like a victim, like you brush and clean, you eat foods that destroy your teeth, you've actually got a food system that will defend you. And that's an amazing kind of piece of empowerment that kind of really changed the way I looked and spoke to my patients. And it really does help you to think that, hey, that there is a really important system here that provides one, immunity and safety to conditions like tooth decay, and then also to how this links into the rest of the body, because like these fundamental principles show us how to live for healthy lives everywhere else, because the the dental system itself shows all of the early signs that then become systemic inflammation. And
Yep.
so and I think it's one of the big problems in the healthcare system is that we disconnect the mouth and the body. And then so you've got your doctors looking at all these systemic issues, and you've got dentists looking at all these oral issues. The twain will never meet. But the problem is that when you bring it together, you actually kind of see it really clearly. And this is what really helped us in our dental practice. It's like once we link those things, and once you kind of change that view, you talk to patients about their patient histories, and you think about their fundamental physiology, which goes a bit further too. This is all just nutrient based. You go into the functionality and the breathing and so forth, and the structure, and that all shows us how the system's working. But then it changes how the patient's experience on a healthcare system works as well, because they're understanding why perhaps their thyroid or their autoimmune condition linked into an earlier breathing inflammatory growth and development problem in their jaw, and then how that all kind of flowed through. Or their risk of decay was a deficiency or gut related, intolerance like gluten, or largely deficiency related, that they can actually change through focusing on those nutrients. It just really flips the point of view, which I think is much more meaningful in the way we practice medicine.
Yeah, I think a lot of people just in medicine generally, they separate organ systems. Oh, it's just a gut issue or a skin issue. I had the chronic chicken skin on the upper back of my arms when I was younger, and they just, oh, that's just a skin condition. But it turns out it was a vitamin A deficiency because I was not eating any vitamin A rich foods. I thought they were bad for me. And then just eating produce was not enough to fix that deficiency. And then, of course, blue light toxicity. And so, yeah, I think just so many practitioners in our centralized system are so quick to just, section things off. And it's like, oh, you have bleeding gums, you have a lot of plaque on your teeth. We don't talk to people about how that could be leaky gut, non-native EMF exposure, blue light toxicity. All these things can show up in your mouth. Do you think I'm correct in saying that?
Yeah, well, absolutely. We kind of go through with dental, the way I kind of like, it's a really nice way to kind of just simplify the important things, right? And it's like the first thing is nutrients, and like for instance, calculus buildup. If people get calculus buildup on the bottom of your teeth, most times you'll go to your hygienist or therapist, and you're getting a lot of buildup. It's like you got to floss more, you got to clean it more. But then, like if you think about like the actual the mechanism of calculus buildup and how this pathologically builds up, you shouldn't really be getting calculus or calcified plaque caked up on the teeth. Like this, it should build up in very small amounts, but it shouldn't cake up in like it does in many people. And what it is a problem with calcium metabolism. And the thing I actually learned from Price about that is that he was looking for a third nutrient in his time. He said vitamin A and vitamin D all work together. And then the third nutrient seemed to be this, what he called activated X. And he died before he actually identified it. His book was published and it was actually applauded. And then it fell out of favor with the dental kind of community and got lost for like 60 years. And then a community 60 years later actually found that there was all this research on a set of molecules that were very similar in acting to what Price is talking about, and that's the vitamin K molecules. And vitamin K is phylloquinone or menaquinone system. So they're these ringed chemical structures that are really complex, and they're not very well known in Western medicine. We don't talk about the applications of menaquinones, for instance, at all nearly. We're only just starting to now. But in Japanese and Eastern European, like Polish and so forth, Czech research, they actually had quite a lot of understanding on what these phylloquinones and menaquinones do. And so phylloquinones are vitamin K1 molecules. That's the one that controls their clotting, the ones that we give to babies when they're born, which may or may not be the most effective thing to do. And the menaquinones are the converted vitamin K molecules that are different, and they're fat soluble, these ones. And so they actually work with vitamin D. And this was the activator X that Price was missing. And what they do is they pick up the calcium. So vitamin D is the absorber, and then vitamin K2 then activates the proteins that picks up the calcium out of the soft tissues, so out of your heart tissues. And this also goes back to the vitamin D study we talked about, is that they weren't looking at the levels of vitamin K2. So if you flood someone with vitamin D and calcium without K2, they're going to build up all this calcium in their tissues, and they're going to have an increased risk of cardiovascular event. Now, the K2, for one, picks up all this soft tissues, for instance, around the teeth. So if you have matrix GLA protein and osteocalcium, which are the two vitamin K2 proteins, if you have them activated, your body and saliva will clear that calcium, because it's a very complex calcium system happening in your saliva that that you need to kind of make sure the consistency is right, which is vitamin K2. But the K2 actually helps us to clean up the calculus. And so that's a really empowering point that Price made, that these three nutrients, A, D, and K2, if you're getting a lot of calculus buildup in your mouth, it's a warning sign that this is happening in the body. So for soft tissues in the heart, kidney stones, prostate, and even you're showing calcification issues later in dementia because of the lack of buildup through the or the lack of clearance through the brain. A lot of the disease mechanisms are based in the incorrect placement of calcium and minerals in the body. And then, so this is a really big clue. So if you're vitamin K2 deficient, then there's likely a much higher risk of A, these problems happening in the mouth, and then B, turning into a systemic issue later on.
Yeah. So the mouth and what's going on there is really, I guess, a warning sign for people. If you're having a lot of dental issues, it's a sign of a deeper health issue. Would you say that?
Absolutely. Well, it helps us. It helps us to understand the fundamentals that guide all of the problems in the body. And so the way I kind of found that that it works through oral diagnosis is that I had this kind of nutrient view. It's like, okay, so all these nutrients are really critical to all these oral processes. And then you follow down with all the research to show vitamin D deficiency links to every chronic disease there is. So you could guide through someone if they have an oral issue and they have any kind of digestive, any kind of autoimmune, if they've got any of those issues, they have to just firstly sort out their vitamin D. And it's kind of like one of those really like basic things that you just fundamentally start to build the basis of how you're kind of carrying through and thinking about a treatment plan. But then, so then there's things like blood sugars. Well, of course, for the mouth, we know that sugars are extremely harmful, but then so flowing down and controlling our blood sugar and metabolic health and insulin and all of the hormonal issues that occur due to sugar consumption, but then also to the problems that happen in the gut microbiome and a whole host of issues that all link into the overconsumption of simple carbohydrates in all forms. And so that's a really simple one too that starts in the mouth. That played out. Dentists were jumping up and down about sugar like a long time ago. And we just didn't link it. We didn't link it to obesity and systemic issues until, probably 10, 15 years ago. But dentists are saying, hey, this rots your teeth. And we know that it did. And we found a mechanism, and it's not the whole story, but it's important. Right. And that's why dentists talking about it then was important, because they were saying this is bad for us. And then what we did is kept eating it and actually increased our consumption of it. The tooth decay link came out in the 70s, but so we increased our consumption of sugars and simple carbohydrates by 2010, 2020, the rates, even though we had public measures to decrease tooth decay, have still increased. So it's one of those things that has been running around with sugar, but in the mouth, it's really simple. And then you've got things like the immune barrier, so the oral microbiome, and so how the bacteria are working in the mouth, how that's communicating to the body. And then the other thing is the structural issues, is the breathing and how we use the musculature of the jaw, the postural issues that is really interesting, because you start to link into things about the airway and the neck and the jaw, and how posture and how we put our body in space is affecting our body in general. And for kids, if you correct their tongue posture, so if you get them to correct their tongue posture and breathe through their nose, their development of their jaw the trajectory will actually change. It will start to move to develop better in order to prevent crooked teeth, which is like a big one, right? So this is something that's telling us, hey, we need to get this into kids early. So you fix the nutrients and you get their posture and breathing right, and they might develop right so that their craniofacial system, the base of their airway, the base of their skull, their brain develops the right way, and then you're potentially preventing orthodontic braces down the track. So there's this whole structural kind of story as well that we've just completely misunderstood.
A lot of people are quick to talk about the benefits of sunlight, but what gets often missed in the conversation is the benefit of darkness and the importance of protecting yourself from blue and green light after sunset. That is why I choose Viva Rays as my go-to source for protecting my circadian rhythms. You can use the code YOGI to save 15% off at Viva Rays. Now, you may have seen some of these studies popping up. I call them fear mongering about blue blockers not being effective. And that is a partial truth, because when you use blue blockers that are clear or that have not been tested with a spectrometer to actually block what they say they do, they will not protect your circadian rhythms. And they are not catching those key wavelengths that you need to be blocking in order for your body to be able to repair, for you to make melatonin, which is a master antioxidant. And artificial light at night has been in the scientific literature extensively linked to a host of hormonal cancers, obesity, diabetes, and all sorts of metabolic issues. That again is why I choose Viva Rays as my go-to source for protecting my circadian rhythms to allow my body to get adequate darkness at night. You can use the code YOGI to save 15% over at Viva Rays, and you can actually trust that they block the frequencies of light that they say they do. Thanks to Viva Rays for sponsoring today's podcast. Yeah, I think that that's really coming to the surface more and more these days, and it's something that I know I need to find an airway. I just want to have my son checked out because he just turned 2. And so I'm definitely interested because he has a beautiful jaw, space between all of his little baby teeth that have come in. But of course, like this whole airway dentistry and furthering the jaw development as they get older, I'm finding like maybe checking them for, I guess, the what you were saying, like the tongue posture and the tongue ties are a big one. That's what everyone's talking about these days, is fixing the tongue ties. Is that something that you talk about or help people with at all?
Yeah, so the tongue is like a muscular organ. It's a digestive, it's a lymph drainage organ. It's a really complex set of muscles and fascia that
Mm-hmm.
link into how we kind of posture our jaw. It supports the back of the airway. If you look at how the back of the tongue influences the volume of the airway, it opens up like a tent when your tongue is sealed up to the roof of the mouth, but then also back to the soft palate. There's a really kind of interesting link between how you strengthen and actually connect the tongue up to the back of the soft palate during swallowing, but all the time as well during posture, during movement. And we seem to have lost that. Kids seem to have lost this kind of intuitive guidance of the tongue to the roof of the mouth. And it's one of the big things that then guide the postural maybe the poor growth of the craniofacial system. So the increased risk of a jaw that doesn't fit teeth, because if you look at the palate of a child, then you can see if a kid with a high narrow palate will have a smile that is narrow and thin, and then you'll have a crooked upper arch, and that is mainly due and driven during these age groups to the sealing up of the tongue to the roof of the mouth. And so it's kind of a really deep inset. I think it used to be like just a reaction. People kind of just developed it intuitively. It was part of, how we, for instance, in breastfeeding, it's very, it's built in terms of how the child extracts milk from the nipple. But I see a lot of kids that are extended breastfeeding, and they have the same dysfunction of the low tongue. They kind of get into this, what we call a tongue thrust, a low tongue and a tongue thrust swallow, where the tongue goes forward when they swallow. So the tongue should go upwards and backwards. If you test, you can test a kid by getting them to hold, or probably for a 2-year-old, you'd have to. This is a little bit early for a 2-year-old, but as they get a little bit older, you can test them by holding their lips out, get them
Mm.
to bite together and swallow, and you see where the tongue goes.
Ah.
I rarely see any child or adult in general do that test correctly
Mm.
without being prompted and then taught how to do it. So what's happening is the tongue is going downwards and forwards. We are swallowing downwards and forwards. And if you think about what it does to your head, it goes literally
Yep.
like that.
That.
Yeah.
Yep.
So when you swallow upwards and backwards, it actually kind of takes us like the chin slightly back, straightening the back of the cervical spine, which has a big
Mm.
connection to the neck. And there's this deep swallow motion that you can actually close out. You can make a noise once you get it exactly right. There's like a little, you can hear the vacuum in the back of the throat.
Mm.
And then what that does is it then seals that off, and then that's the complete swallow. But every time you do it, it corrects your posture. But you
Mm.
feel the pressure on the palate and the widening as you do it. And so I think kids don't have this. Tongue ties are a developmental issue now. So what
Yeah.
happens is that in birth, we find that kids sometimes have these ties. I've actually been released under their tongue because what happens is that at 12 weeks of gestation, you have the tongue developing as one with the lower jaw. And then what
Mhm.
happens is it starts to separate by 12 weeks. So by the time it gets to 12 weeks, the tongue and lower jaw should be separate. What seems to happen is this process gets gummed up. It doesn't complete. And then the tongue will separate, but then there's this slip of tissue, which we call ankyloglossia or a tongue tie, that is stuck. And then the child is born with a tongue that's stuck to the floor of the mouth. Or
Mhm.
in most people, it's not. So like you have degrees of severity of tongue tie. So you can have it like this, where
Mhm.
it's, I've seen kids or adults. I've seen people that have lived their whole life with their tongue pinned to the floor of their mouth, and they're like
Mm.
this, and they cannot. This is a severe tongue tie. This is the one that most people pick up, the one that gets released at child, or released probably to hear in birth,
Yep.
or just after birth. But then as we go on, you start to see the tongue lift. There's grades of ties down there. So what you find is that most kids have some level of tie now, and they're
Mhm.
affected in different ways. Some kids aren't really affected at all. Some kids are really affected where they have,
Mm.
maybe a 75% or 60%, and they just don't lift the tongue well. Most
Mm.
kids don't, and it seems to affect them. It affects the way they can lift the tongue.
Mm.
So the decision on releasing a tongue, I found, the two most useful times if it is a severe tie at birth, and then if it's not severely affecting, so if it's not affecting speech and it's not affecting swallowing and there's no real major issues, then waiting to say 7+ to get an
Mm.
actual
Okay.
release where they can have it done consciously, because otherwise they've got to go
'Cause they
under.
have to do, like, all the exercises and things to rehab afterwards, right?
That's right. So you need to
Yeah.
learn to use the muscles. You have to do the
Yeah.
exercises,
Mm.
and there's two types of release as well. There's one under general, which most kids will have done if they're having it done in where they can't sit in the chair, which most can't, or
Right.
they're kind of conscious and it's they're under LA and they're screaming and it's awful. But the conscious releases, which from 7, 7's probably starting to get early, but kids, you can 7 between 10, that's a good time to do it, because then you can get the child to consciously do the exercises,
Mhm.
strengthen their tongue, understand how to use their tongue, have the procedure done consciously while they're lifting the tongue. And so the
Mm.
physician then gets to look and stitch and then get rid of, as best as they can, get rid of the tie while the tongue is actually functioning,
Mm.
stitch it up. The child moves the tongue over the days as it's healing. That's when you get the best results. So that's what I've found clinically as being the two times that are most successful to release, is that a newborn, to get that benefit, they usually need a second round because the tie is incompletely released or there's scar
Mm.
tissue. And then
Mm.
7 onwards, maybe for functional releases.
Yeah, it's definitely something people are talking a lot about now, and I'm like, "Oh, I" you try to do everything right with your kids, and it's one of those things that my daughter, she has a beautiful jaw. She's never had to have braces or anything like that. She'll be 17 in December, but I changed her diet when she was very young because she regressed into non-speaking autism when she was about 16 months. And so at that time, I just dove headfirst into like diet. I have to give her the best diet. And so she was eating like grass-fed beef burgers and from a very young age. So I feel like all the meat that she ate, all the chewing she did, she's got just this beautiful teeth. Unlike myself, I grew up eating like Pop Tarts and everything fat free and microwave meals, and my teeth are just not. I'm like, I'm 45. Do I go through the fixing my teeth thing or just like leave it, But I know my teeth were a result of a really nutrient poor diet. And I've definitely got some asymmetry in my body as well, that it's like one hip always gets turned under, and I know it's all related. So yeah, it's
The early stages, like what you did for your daughter there was, just one of the best things you can do as a parent to kind of give them those developmental nutrients.
mhm,
And it's one that I just think it's young people that are expecting or have young kids, they're just not told that, hey, you need to feed your kids nutrient dense foods as much as possible, because if you think about how malleable a child is at that age, and
yes,
we live in a modern world. As kids get older, we know things get more difficult, and so things get harder and harder and harder to control. When you can control the intake of a newborn at six, and from 6 months, and then also the mother's intake as well,
oh
you know,
yeah,
f- before as the child's developing, like you've got so much, so much hold over what the child is getting over that time, and if you know exactly what these nutrients are doing, then getting these core things into them then is just so critical. And then you see that hopefully through the developmental periods. The thing that I'm seeing as well is that we're also looking at a kind of a DNA, and a generational thing as well. It's that
hmm,
even kids today that are fed nutrient dense diets, like I've got 5 kids, and
wow,
the their jaws are well developed, and we did the nutrient thing. Probably not, the maternal diet probably wasn't as good as it should have been during pregnancy, but the development of the jaw, we've already done one set of expansion on the two oldest kids,
mm,
and they're 6 and 4, and so that's where I think you start to make the impact. These bones are like butter, and it's like they
yeah,
just go like that when they're
mm,
in this early stage. And the orthodontic system we designed is like three phase. It's like 3 to 6, which is this earlier phase where you just do kind of straight development of the palate, and then you get into more the myofunctional, the muscular side of orthodontics between 7 to 12. And in those cases, you can, in 100% of kids, you can prevent braces, because you just develop the bone, and you let the body put the teeth where they want to go, instead of trying to drag them with braces later on.
yep,
That's really, really critical. Like you spoke about posture, imagine how your jaw joint affects the rest of your body, and it does. Like
mhm,
how sensitive this there are cranial, probably about 4 to 5 cranial nerves all dictated through this area here. And then what happens is that when you have an asymmetry, which is related to jaw development, which goes like this,
yep,
you're constantly in a message that you're out of balance, and that your body's and brain's trying to measure where you are in space and time and
mhm,
earth. And then it's constantly like off, and it's constantly having to recalibrate, constantly have to put a leg a certain way to kind of keep you balanced and
yes,
so forth. That creates postural compensations. They've showed that in rats, particularly, to start with, that when you correct jaw issues, you can actually correct certain grades of scoliosis. And they've done this
wow,
in kids with brace with old studies with the back braces, that they actually put jaw supports there as well, and that
mm,
helps straighten the spine in severe scoliosis cases as well. So the
wow,
jaw is connected to how the spine ends up developing as well. And then that links into the tongue, which is a fascial system that runs to the toe. So the tongue then supports that bony system. And then how we use that, and how we're breathing, for instance, like in yoga, they
yep,
say tongue to the roof of the mouth.
hmm,
Well, what is that? Like, what is tongue to the roof of the mouth? And like, I've found that most yoga teachers, they don't know how to say it. They don't know how to direct the tongue properly to the roof of the mouth. And then how you actually think about that during a posture. It's like there's different levels of suction,
hmm,
because this is another,
Bondas,
there's certain levels of vacuum in the body that
Hmm.
we like the diaphragm, and then but the tongue is another as well. And
Hmm.
so when you seal the tongue in different ways, it kind of gives you access to different movements and postures and so forth, which you feel in yoga. And I think that's something that's probably, I think, like advanced yogis probably have it intuitively, maybe, but then you also see that they're, kind of some of their breathing is a bit off sometimes too.
Hmm.
They tell people to breathe out the mouth,
Mm.
which I think is a big no-no, and that's
Agree.
that's that's still a majority, right? In yoga, they still say breathe out the mouth most of the time.
Ashtanga yoga, I did that like very strictly for for a while, and that was where I learned about the bandha system and kind of the different,
Yes.
yeah, the suctioning of the body. Because if you wanted to do all these kind of intricate poses where you're balancing on your fingertips and
Mm.
all the things you probably shouldn't be doing over 40, which are you know, dropping back and all these things, you had to have, they always had the breathing in and out through the nose. They never would let you really do the mouth. And then you had to learn how to suction, different parts of your body in order to do these poses. And yeah, you would see a lot of people struggle with it. And it was like once you could kind of connect the breath and the posture, it was like it would click. But
It clicked.
it took a long time for me to, because it's just not innate to kind of figure out how to do those things.
It's very difficult to link breath and movement and postures, like really hard. Yeah,
Mhm.
and like you said, that the Bunzer system then links into, and the tongue. When someone has, for instance, you may not be able to connect that Bunzer because of a tie, or because
Mhm.
if you've got a really narrow jaw, it's going to be hard. Like it's
Yeah,
going to be
I think that was
really.
my
Some people
problem.
just cannot get their tongue properly to the roof of the mouth, and it's like when I'm seeing that in the chair, I'm like, well, we're going through a journey here. It's like, how do you've got to first strengthen the muscles.
Mhm.
We might think about some expansion over time, which is quite gentle I think should be quite gentle for adults.
Mhm.
And then, they might need a release. So it's like a 2-year journey to get the tongue to seal up. And then you can maybe kind of talk about it. So then when we're talking about developmental issues, understanding how that has affected us, also kind of links into, how we're posturing, how we're kind of, maybe ability to do yoga postures, which then, kind of talks about, how the things like, fascial and meridian systems are working. So there's a
Yep.
lot there that kind of tells us that the body is out of kind of tune when we don't develop correctly in the jaw.
Yeah. Yeah. And I mean, I think a lot of it starts with nutrition, but like you're saying, there's kind of this generational issue that's happening now where it's an entire system that's out, and it has to do with the cranial bones and like the whole entire system just kind of being out of alignment, would you say? Or is it just
Uh,
all connected?
no, it's all connected, exactly right. So I mean, for instance, I didn't have braces when I was a kid, but
Mm,
I didn't have um lower wisdom teeth, so just didn't develop them.
mm,
So then obviously like that's a jaw under development that because I'm lacking these teeth here. And I also didn't
mm,
have adult premolars in my
mhm.
lower jaw as well. So that's just something that my lower jaw is going to be underdeveloped in that way that would be due to the lack of dentition. So that's going to affect, for instance, the back of my airway. And so, for instance, for me, that makes me somewhat of a risk of upper airway resistance syndrome and snoring, which is a big one. So your breathing during sleep is a big one. This was what kind of affects us very subtly at first, is that people with any kind of tongue, palate, jaw issue or nose issue, swollen tonsils and adenoids when they're kids, they don't breathe well at night, and then
Mhm.
during night they're not developing well. And so later on
Mm.
in life, that becomes the brain and like how we're oxygenating the brain. We know that sleep apnea is now heavily linked into Alzheimer's disease. It should be one of the first things we're looking at in anyone that are having risk or showing signs of early dementia, because they're not breathing well at night. They're starving their brain of oxygen. But in kids, it's how they're developing as well. So you've got the two-pronged issue of breathing through the mouth or choking or snoring during sleep that is inefficiently using the airway system, but then incorrectly growing the jaw and then affecting the growth development of the brain, which is really concerning for kids when we think about young brains not getting enough oxygen at night.
Yeah. I mean, it's scary to think of that is such a big problem for our kids now. So an airway dentist is where you would probably have someone go to evaluate their child.
Yes. So airway. So kind of functional dentistry, like the way I kind of put it, was like there's different kind of ways to view it. One is with materials and kind of like metals and things and like
Mm-hmm.
chemicals and so forth. Like what are we putting into the mouth, like metals and fluoride and so forth. The others are like the materials that they'll place. So like are they biocompatible? Then you've got things like the airway and development, so sleep apnea and pediatric growth and development. And so dentists will call this airway dentistry. You'll have to kind of see how they do it because it's kind of
Mm.
done in different kind of ways. Some practices will just do adults where they do splints and they do more adult based therapy. Some will do kids and they'll just do that in a certain way. Like there's lots of different systems and ways that dentists do it. If they're saying they're an airway dentist, it means it's good. It means they understand this. It's just that certain
There's different
dentists,
methodologies.
yeah, the methodology is different. So, for instance, not many practices will treat under five; they just won't do it, and
Mm.
that's fine. That's that's fine. And but some kids do need treatment before five. So it's like,
Mm.
okay, if you get told that you don't that you they don't do treatment, it's probably more from methodology than maybe exactly what your child needs. So you do have to do a little bit of shopping around. Unfortunately, the
Yeah.
services aren't very common now, and that's something hopefully that will change in the not too distant future. Because if you think about it, like this is how our kids are all developing. Like this is where we should be going for our healthcare, right? Like so,
Mm-hmm.
the first thing is like right. So your son's two. It's like we're thinking
Mm-hmm.
about okay, his jaws, he's got good teeth. The pediatric dentition can be quite it can be a little bit of a wolf in sheep's clothing. It's like, oh, it looks great. All of a sudden, when they're 5, 6, 7, when the adult teeth start to come in, you see these huge adult teeth coming in. It's like, whoa, this jaw's not as big enough. It's not big enough as to what this child needs.
Mm-hmm.
And that happens in so many kids, and kids with no spaces or kids with a slight open bite or any kind of functional issue, they're the ones that really need early intervention. Your child may not be in this category, but there are more subtle signs in the 2 to 5. Two is quite early. We normally started to treat more about 3.
Mm-hmm.
2 is kind of identification, maybe seeing habits and stuff that we can shift. But 3, we can start to do things physically to change the jaw. And I generally find with kind of myofunctional therapy, there's kind of a link there with speech therapy. So getting a
Mm.
young kid to do exercises with their tongue and mouth is exhausting. And
Yeah.
it's like, do you expend that energy then until they hate it and they'll never do it again in their life? Or do you do some small subtle things and wait until they're a bit more mature, and then during that second phase, the 7 to 12 phase, and then focus on it? Then I found that to be more effective, where you actually treat the behavioral changes between
Mm.
7 to 12, where will actually do the exercise potentially, rather than forcing an under 5-year-old to do all these exercises that they hate and they
Yeah.
don't want to do. And then I've found that it's more effective. So there's ways to kind of, every kid's different.
Yeah.
But yeah, we're trying to take them through a developmental journey that is individual to them.
Yeah, I think that's important. And it is a matter of shopping and finding the right person, because there are a lot of people that are airway dentists now. And I'm like, what would you say if someone's listening to look for if they are looking for an airway dentist and their kid is, maybe older than 5 and they suspect there's an issue? Like, do you have specific criteria? And does the same go for adults as well?
Well, it's hard to know. It's
Mm-hmm.
like, because some practitioners will say they do it, and then it's kind of like there, and it's like, there's a system that they've kind of put in, and they don't really kind of do it very in depth. I've found that there's no one system that kind of fits you. There's a multitude of things and like tools that you kind of do, because it's a moving target. Like we're talking about a
Yeah.
developing kid, or
Mm-hmm.
like, so for adults, certain treatments are pretty, mandibular advancement, and there's, kind of surgeries and expansion stuff. Um, usually if they're doing that kind of stuff, that's a bit more set. With kids, it's a
Mm,
bit harder because like there's this whole behavioral aspect. We
mm,
found that doing volume with kids is you have to kind of meld and mold with the needs of the kids. Like I find this can be quite a stressful kind of thing for parents. It's
yeah.
like, oh my God, what are we going to do? Like my kids' jaws, and they're right, it's important, but
Mhm.
you do kind of have to, in a way, relax through it a little bit because it's a long road. It's like 3 to 12. And like we're making the right plan that there'll probably be intense work somewhere in there, but at least for 2 years. Some kids will need something like 3 years. But if you
Mm,
get that in, then you're likely to kind of to prevent those problems. Now, picking a practitioner, so there's different systems. There's like in America, the two kind of myofunctional based systems are Healthy Start and MyoBrace. So that's
mm,
a good sign that they've got some kind of training in the child development, the phase kind of growth of orthodontics and using. So these are devices that aren't like kind of glued or kind of or like fixed traditional devices, which I think also do work.
mm.
However, if they use that as well, then you've got a kind of nice partnership. So some practices, there's kind of three techniques, right? There's the phase, what they call phase one, which is the expanding devices, which can be there's all
Is
sorts of
that
different
you
expanding
wind
devices.
those with a key? Is that those?
Yeah, most are wound with a key. So you'll either
Oh,
wind
I had
yourself,
one of
it'll either
those.
be removable or fixed. And then so that's kind of like just raw expansion, and like that's
Mhm.
great. Then you've got like kind of the traditional orthodontics, the braces or Invisalign that kind of aligns the teeth in a plan to put the teeth where you want them to go. And then you've got these habit forming devices, which is your MyBrace Healthy Start. And then practitioners will use them in kind of like a different way based on what they've done. They might use one, they might use two. So you've kind of got to get a view of, are they using fixed? Are they using myofunctional muscle-based stuff? And how do they use expansion? Um, I find that, so we found that expansion is really important, and we like, what I found is expansion mixed with myofunctional devices is really good, because that, with kids, when you can get that in that 3 to 12 period, that's the one that works really well. And if they have those two system, that's good. Some will use a bit of kind of clear aligners, and it's kind of quite topical now because Invisalign is actually talking a lot about expansion with clear aligners and stuff.
Mm,
I think that because I've looked at orthodontist work that's like, and I'm not a specialist, by the way, but I've just looked at work that uses braces compared to how the kid develops themselves. And there's
mhm.
something natural, there's something kind of in the way that the body places the teeth that we seem to kind of maybe misunderstand or maybe
Yeah.
not quite comprehend. And then so if we're using braces and clear aligners, are we inhibiting the body's want to put a tooth somewhere? And what
Mm.
is that telling us? So I like to kind of, you try to fix the parameters and then you let the teeth go without guiding them. But some practitioners will use clear aligners. You get great looking results. But I mean, I think there's probably maybe two philosophical camps there as to what exactly might be the best overall for the body.
Yeah. I mean, I had braces, palate expander, did the whole thing, took out like all my wisdom teeth, and my teeth are still jacked up, from all that stuff. And it's like that my body, for some reason, because of the alignment, is putting my teeth in this way. And I think that you just trying to like manually change it, something in is just that is doesn't work, because the teeth, unless you use a retainer, are going to continue, or they're going to go back to the way that they were. So I feel like just modern dentistry with just orthodontics and that being the route that they take, I think is ineffective. And taking out the wisdom teeth and doing that whole thing, it's like, I just question a lot of that.
Yeah, well, I mean, wisdom tooth, I mean, that's kind of, so we've been talking about the development of the jaw between 3 to 12 when all the adult teeth are being replaced. And then you have this second phase of development between, 16 to 25, where the four wisdom teeth should be erupting.
Mm,
Now, the jaw is continually growing during that. You look at adolescent faces, they've got this kind of roundness to them. It's kind
Oh,
of like
yeah.
they're young and they're kind of, but then as they get to, you know, their 20s and so forth, you start to see this square and nature's
Mhm.
more, and that's the actual development of the back, the downwards and backwards growth of the upper and lower jaw, and that's to fit those wisdom teeth. Now, what we find is that we don't. This is one of the first things actually. Darwin's oral surgeon noted this. He said we don't seem to be fitting wisdom teeth like we used to. So this
Mhm.
is one of the first signs that that our jaw wasn't growing like it should.
Mhm.
And so for some people, we haven't had adequate growth to house those teeth. Now, if they're in a funny angle or so forth, it's
Mhm.
probably, you know, they probably do need to unfortunately be removed.
Mhm.
But, you know, are there ways to kind of, you know, mitigate this? Are there ways to kind of think about how we grow the jaw? Absolutely. You know, we should be thinking, you know, what are the issues that have stopped the growth of the jaw, which is, like we said, the breathing and that deep tongue posture. Probably a lot of probably runs into body movement as well, because as you're growing and maturing, you're starting to do sports and so forth. So like how you're moving your body and so forth, and how you're breathing, and how, you know, like talking about um, the yoga connection to postures and tongue control and so forth, and fascia, that is probably a big influence as well in wisdom teeth development. So all of that should probably be coming into thought much earlier, say about 13, 14, once you got the
Mhm.
teeth straight. So let's get this kid moving and functioning and breathing right in space. And then, yeah, they're going to develop right because they're moving and developing as they're designed to. It's like,
Mhm.
I think there are things there that we really need to get on top of.
Absolutely. Yeah, and our modern environment is definitely not set up to support that at all, and I don't think that education is available for a lot of people. You kind of have to find it yourself, and a lot of people aren't gonna look at it until it's a problem, unfortunately, I think.
That's right, and, you know, that's kind of been the way that, you know, modern orthodontics has been,
Mhm.
set up. It's like you see a kid, maybe about 8 or 9, and you see some kind of huge incisor teeth at the front, and you go, "Oh, they're gonna need braces. We'll just wait until they're 12 or 13, and then we'll see, and then we'll do the orthodontic work." It's like, well, if we can get in there and develop this jaw and change why they're underdeveloped, like, isn't that gonna assist them much more? And I think
Mhm.
that's a big part of the picture that we're unfortunately missing, because we're not seeing how influential we are to teeth and the jaw, and then like how we can actually change that. It's something I think we really need to click into, because kids are suffering of sleep apnea at increasing rates. This is affecting their risks of things like ADHD,
Mhm.
autism, all sorts of kind of developmental issues. And, you know, they're even talking now about pediatric dementia. I don't know if have you seen that
What?
recently?
No.
So kids dementia is a thing now, and it's like their brains aren't developing in a way that is satisfactory, and they go into decline, and they don't make it through adolescence. It's crazy. Like
Oh my
this has
gosh.
been talked about more and more. It's like, okay, at what point do we see that dementia in childhood is not right? And so
Wow.
that's all of this just happening earlier. This is happening in front of our eyes. Like, we've missed
Wow.
completely what the problem is. We're trying to treat it at its end stages with medications and surgeries, and it's just not working. And
Wow.
the way it kind of plays out is like you get the heart attacks first in the 60s, then you get the metabolic problems, the diabetes second.
Mhm.
But before that was the tooth decay and the misalignment of the teeth. But the problem with that is that when you misdiagnose the dental stuff and you just go to the heart attacks and you start to say, hey, don't eat saturated fat, and then you feed them more sugar through the 80s and 90s, then you get these jaws that are developing less. And you got these kids that are like this. So then sleep apnea becomes this huge problem. We've got over 1 billion people on the planet with sleep apnea. If you want to have a safe bet for kind of investing in shares, invest in a sleep apnea, a good sleep apnea company, because
Yeah.
like CPAP machines are a huge business. They make
Huge.
buck on this stuff. It's like 2 or 3 grand or whatever for a breathing machine. It's life support
Mhm.
at night.
Yeah.
Over 1 billion people on the planet with diagnosed sleep apnea. Imagine how many people have
I
the
know.
problem that is
Undiagnosed.
underdiagnosed. And
Yeah.
then this is choking in our sleep. The third set is, which is what they're saying, is Alzheimer's, the rise of Alzheimer's, which is, they're saying, by 2050, but it's coming in a lot faster, is that the brain development, which is linked to all of that. So that's the set of diseases that come out when you don't understand this. And then kids are getting sleep apnea earlier and now dementia. It's like happening in front of our eyes and we're just missing it.
Wow, that's terrifying. And this could be prevented with a proper airway dentist and proper nutrition and just following the child along their development. Would you
That's right.
say?
That's right. If we
Mhm.
just identified these things as being critical for kids' development and getting parents onto this early, getting them eating right, not giving
Mhm.
them, cereals and all this kind of stuff that
Juice.
yeah, yeah, right.
Never given my son
Not
juice before.
yeah. Yeah, the not getting the nutrient poor, and the
Nutrients.
main thing with those things, like it's they've got no nutrients in them. That's the problem.
Mhm.
It's like, they've got these colorings and things, but then they're not getting the nutrients. They need the fat soluble vitamins. That's what they need.
Right.
And like if parents were kind of directed to that, and then we had a healthcare system that got onto kids at 3 to 4, and or earlier even, looking at their tongues from birth and helping the breastfeeding modality. Breastfeeding is really hard too. That's a whole thing.
Yeah. Oh, yeah.
But and then we're developing the kids during those periods. We're preventing 95% of those problems. Think of how the sleep apnea industry would be if you had a population with jaws like this. It would be nearly non-existent.
Mhm.
But these are things we need to think about because like it's happening in front of our eyes, and unless we kind of take drastic change, it's really taking people, and people are awakening to it. Parents are realizing, hey, this is important. I need to get my kid onto this. But they're finding, they're having to drive,
Oh,
100
yeah.
kilometers to get, or, 100 miles to get to a practitioner. And that's a lot of work over 2 years. Like we had people flying to us. And
Wow.
it's like, how do like it's it's important, but like most people don't have the means for that. Like it's
Yeah,
great
they
these
don't.
people can do that, but most people do not have the means, the time. You got young kids like flying. I don't know how people flew their kids. Like driving my kids to the park is a problem. Like it's a serious. Uh,
One
but,
one of the worst experiences of my life was
so if we
taking
think
my
about it on a
daughter on a
healthcare
bus.
scale, it's like this is a big issue.
Oh, yeah. It's a huge issue, and
Yeah,
again, it's just not gonna be accessible for a lot of people, so if they can start with the basics of good nutrition, getting nutrient-dense foods in their kids, I think they're gonna be ahead of a lot of people. What do
yeah.
you think about
And then being kind of mindful of, how the kid sits posturally. So
yes.
do they sit with their mouth open, their tongue hang out? Do they put their head forward? Obviously
Mm,
devices are an issue. Devices are fine, but like when kids start to kind of get into this hunch mode, that's affecting their jaw development. How are they
mhm,
sleeping? Like between kids, between 1 to 3 should really be watching how they're breathing. We should be monitoring it all through, but you can hear them breathing.
mm,
And are they snoring? Is there sounds? Are there kind of movements? Are they sleeping on their stomach? Are they or do they wake or do they wet the bed? Are they having night terrors? There's a lot of signs there that showing the airway is not working because the unconscious airway gives us a lot of hints. Teeth grinding is a big one. So kids that grind their teeth is due to pressure in the airway, so they're moving the jaw forward, and so like that's a big part of early identification of an airway problem. That hey, we need to kind of get onto this.
is the same for adults grinding in the sleep, is that an airway issue as well?
Yeah, most of the time, most of the time,
Mhm.
yeah,
Yeah.
it is it's an issue that the brain is being confronted with the closure of the back of the oropharyngeal airway, and then they're pushing the jaw forward to open up. So basically, I would say with teeth grinding, we're showing it's an improper posture. It's the improper use of the cranial nerves. Because if
Mm,
you're doing this, it means we're
mm,
not using the tongue properly. Because the proper posture of our jaw and teeth isn't with the teeth together. The teeth shouldn't be together when you're just sitting here like this. They should
ah,
be slightly apart, and the
okay.
tongue should be suctioned up to the roof of the mouth to that spot we were talking. So that deep swallow.
Mm,
And then what happens if you do that? You'll notice the teeth actually just sit apart.
yeah.
And that's so when the teeth are apart like that, the airway's open. But then if you're doing that during sleep, so this is kind of a big trick is how to get your tongue, jaw, and teeth to do this while you sleep. And that's like kind of, training to the point, imagine doing a yoga posture in your sleep. But like obviously that'd be hard. But like,
Yeah.
but in a way, it's kind of like that. It's like, how do you train your muscles so it's intuitive that the tongue sits up there in this posture, and that will stop you grinding your teeth because you don't your and the reason being, sorry, is that your cranial nerve that controls the tongue is switching on all of the tones. So it's this bass tone, which is starts with the hypoglossal nerve, and
Mm,
all of the muscles of the tongue are controlled by the hypoglossal nerve, except for one. And the back one, it's the palatoglossal nerve. It goes up like this to the back of the palate, slings up. That
mm.
one's activated by the vagus nerve. And then so the
Okay.
vagus nerve is, once you get all of those tongue muscles to lift the tongue up, and then this one kind of turns on and it's there, then you're activating that's kind of the first step into activating vagal tone. So hypoglossal tone or tongue tone is actually vagal tone running down through the mouth to the body. And then so a lot of these issues are that we've got improper cranial activation and cranial tone. So hypoglossal tone, everyone talks about vagal tone. Well,
Hmm.
it, the main thing we should be doing with vagal tone is training the tongue. Like, yeah,
Okay.
yeah, cold showers and everything, that's great, but like the tongue and turning the tone on of the hypoglossal nerve, which is in the brainstem as well, that's far more important because it gets our airway working, which helps the whole system start to regulate. And that's kind of teaching us as well that teeth together and teeth grinding, that's all trigeminal. This is all masseter muscle and temporalis. These are chewing muscles. The temporalis is like this, and the masseter muscle runs here. Yeah, so that's when we're chewing. That's when people get these sore areas here, or you press on the temples around here. The temporalis and masseter are overworked because we're not activating, and it's not because we're stress is a problem, and yeah, obviously it makes it worse, but it's because we're not supporting our jaw muscles with hypoglossal airway tone. So our tongue is failing to support that. That's why it's happening.
Mm, got it. Got it. And just, I know I've got to run back upstairs pretty soon, but I just want to close off for adults. If there's someone with a snoring issue, because we talked about the CPAP, that's also a person that probably also needs to get an evaluation from an airway dentist as an adult as well, would you say?
Yeah, like so CPAP can be very useful for people with severe apneas because you've
Mm,
kind of got to get through if your blood levels are dropping, oxygen levels are dropping below 90, 85, you probably need an intervention.
mm,
But the problem I find with sleep apnea treatments is it's very final. You get a CPAP machine, it's like, okay, that's you for life, right?
that's it.
Or even
Yeah.
mandible advance, like a splint, like the holds the jaw forward, which are good as well.
Mm,
They that what's the way off that? So you want to be evaluated, and you want to, sometimes you need treatment because it's important. You can get
mm,
fast improvements to your brain sleep quality and everything. So these treatments don't avoid don't avoid them, but
mm.
you want to be thinking about how there's a pathway off. Like, are there tongue issues, are there space issues in my mouth? How am I long term going to develop this? Because otherwise you're going to be married to this device for the rest of
Right.
your life. Yeah.
Right. Yeah. That's the thing. It's like, it might be able to get you through until you can figure out the root cause of like, why is this happening? Is it uh, an airway issue, diet issue, all of the above? Like, we have to really look at why this is happening rather than just, like our medical system. It's like, let's just give you a pill to suppress the symptoms rather than asking why the body is presenting with these symptoms. There's something it's trying to accomplish by that, right?
Yeah, and like with dental, like obviously there's the empowerment of understanding these root cause issues. Like it's really important. You can change your life dramatically by understanding these things. There's also the side too that some of these things are structural. For instance, my
Mm.
wisdom teeth never grew. I can't magically grow those. So
Right.
it's like sometimes there is the reality that there is some compensation that we need, and you need to understand as well because
Mm.
we're a jaw system. My grandparents lived in the modern diet, so I'm 3 generations in. So how do we kind of live with this and then push our children to kind of on the right trajectory, and then it's going to take some generations to fix.
Yeah, absolutely. And lots of education. So I appreciate all the work that you do and put out. And you've got a really great Instagram presence. I'll make sure I'll link that in the show notes. But if anybody's driving around and they want to follow you and your work, and if they're living in Sydney and they want to see you, you still see patients in clinic?
Yeah, so my website is drstephenlin.com, and my Instagram is at Dr. Stephen Lin. Yeah, and my book is The Dental Diet. If they want to kind of dive into the mechanisms and the understandings of it's really helped me to kind of dive into the actual understandings of, for instance, tooth decay and saliva, the oral microbiome, how the
Mm.
nutrients work in the mouth. It simplifies everything so well so that you can kind of get a hold of that for any kind of issue that you're experiencing in your life.
Yeah. Well, I'll make sure I have all of that linked in the show notes. And yeah, this has been very helpful because I was glad when you reached out because I was like, oh, this is something that's been on my radar that I've been really wanting to dive deeper into and talk about. Because I have several family members that are affected by dental issues and kids. And I know there's a lot of my community members that are listening that probably are in the same boat. So this was just perfect timing that we connected. So thank you so much for taking the time out. It's morning for you, afternoon for me. It's been really lovely to meet you.
Thanks so much for having me. Yeah, yeah, it's definitely something that everyone is affected by in one way one way or another. They, with a family member themselves, or yeah, it's something that can help your life significantly.
Yeah, absolutely. Thank you so much for listening to the Evolving Wellness Podcast. Just a quick little reminder, this is not medical advice nor meant to be taken as a substitute for working one-on-one with a healthcare practitioner. And if you enjoy the show, please head on over to Apple or Spotify to leave the show up to a 5-star review. If you're over on YouTube, please leave us a like, leave us a comment. I really appreciate you for being here, for listening to the show, and your support means the world to me as I continue to try to pull guests from around the world to bring you informative content to empower you to make decisions about your own health. Thank you so much for being here, and I look forward to seeing you again next week.